what are the types of surgical treatment in prostate cancer? So I think this is probably a very open-ended question, I know, but perhaps if you could cut it.
So we can talk long about this question, but to make it short and informative, basically when we talk about surgical treatment in prostate cancer, usually it is concerned in stage 1 and 2 and sometimes in the stage 3. So surgery for prostate cancer is something different than the surgery for the non-prostate or the benign cancer. In the benign, we do something which is called as a TURP, transurethral resection of prostate, which is with a telescope. And here what we do is here we remove the entire prostate and we remove it out of the body along with a lymph node dissection. And then we join the bladder to the urethra. So that is called radical prostatectomy with a lymph node dissection. And that is the actual surgery in prostate cancer. Now, in stage 4 prostate cancer, we do a different surgery, which is sometimes done as a part of hormone therapy or androgen deprivation therapy, which is removal of both the testes. The option to that is giving injections, hormone injections. So that surgery is a different surgery. It is removal of both the testes called bilateral orchidectomy or bilateral scrotal orchidectomy. So that is also a surgery, but of removal of testis for stage 4 prostate cancer. So,
okay. I think as for a start, I think that gives us a broad kind of an outlook as to what is the surgical options available. How does radiation therapy actually work?
Thank you, Mr. Menon. Radiation therapy is actually considered to be some electric current or light, which is synonymous. That's because many people or even many doctors use those terms. But radiation therapy is actually high energy radiation therapy, that is X-rays, which penetrate through the skin and we can focus on the area where we want to treat. So in this case, we have to focus on the prostate and the nearby seminal vesicles, depending on the stage. So radiation therapy as always acts on the cells. That means DNA which is present in the cell. This DNA, due to repeated injury through radiation therapy, it gets killed. Now, many days, you must have heard that radiation therapy goes for many days. Why do we need that many days of radiation therapy? Is that because these cells can survive and regrow. So we have to kill them in toto. So a total dose is given so that the cells get killed, but at the same time, we'll have to preserve the function of the tissues, that is rectum mainly, which is very sensitive, which is posterior, that means backside of the prostate, inferior to it, and the urinary bladder, which is also very close proximity, and the urinary tube, that is urethra, which passes through the prostate. And because of radiation, there is a chance of temporary radiation damage to it, which causes increased frequency. So we'll have to fractionate it, means divide the doses over many days. Hence, that radiation therapy is given in many days and to kill the cells by damaging the DNA. This is the basis of radiation therapy, and this is not like passing a current or some electric circuit, which when they receive radiation therapy, absolutely there is no feeling of something going through the body. Thank you.
Proton therapy, is it superior to conventional radiation?
Okay, this is a very important question again, because proton centers are coming up. Now, everybody thinks, and it's been projected, that proton means it's a life savior. It is not so. First of all, there are no randomized trials that whether proton is better than external beam therapy or brachytherapy. So we do not say that proton is better, or we cannot say as of today that proton is better. An important thing is that whatever the trials which have undergone single institution or multi-institutional proton therapy, they have formed a group and they have done trials. There is no increased survival rate or PSA control rate when proton therapy is done. And having said that, I have to add one sentence saying that in US and Europe, the proton therapy is still not reimbursed. So there is no definitive proof by any of these proton therapy which is increased control after proton therapy. So with this, proton is equivalent or in early risk prostate cancer.
So I think this question to Dr. Bakshi, what specific precautions need to be taken after radical prostatectomy? The aim is to live much longer.
So post-radical prostatectomy, we advise just one perineal exercise, which is commonly called as Kegel's exercise. Apart from that, I would really like my patients to remain as normal as possible. You can return back to normal activity technically in 15 days. So if you are going into lifting something heavy or something, we say do that after 6 to 8 weeks. And the other thing is, many people ask me if you want to go for any gymming or anything, then that is after 3 months usually. Other than that, as mentioned, a good diet, which may be your probably traditional diet. There is no specific diet for prostate cancer, but I always feel that Indian traditional diet is much superior to the Western diet as such. So whatever is your traditional diet, you should continue. Walking is actually a form of exercise only. Any exercise will do. You need a physical exercise.
So the question from Mr. Hari Prakash, how to deal with situations of bone metastasis?
So bone metastasis technically from prostate cancer. That means stage 4 disease. So stage 4 disease is a totally different thing. One thing is that in this stage, the cancer is not curable. It will shrink or it will become very minimum with respect to whatever treatment I or anybody can institute. It will stay that way, and then at some time or the other, even after treatment going on, it will start rising again. After that, we have many other modes of medicine, which may be tablets, or it may be a chemotherapy, or it may be other therapy which is given with the help of radionuclide material, that is after doing PSMA PET scans. And with all these therapies today, the prostate cancer in stage 4 and also in the bone can be controlled, and patients may have median life, which is up to 5-6 years. Median life is a kind of average life of 5-6 years. So somebody might live even 8-10 years. Somebody who has aggressive disease might live 2-3 years. Specific about bone metastasis, another thing is we usually use calcium, vitamin D, and some as required bone health agents for these patients so that their bones remain healthy throughout the cancer disease.
What is the root cause of prostate cancer? The root cause.
Good question, but none of the scientific people who are involved in research or treatment are able to answer this, because as Dr. Ganesh Bakshi alluded to it, the cancer which develops is maybe, these are all projected causes or etiology which is not known specifically, but maybe related to our lifestyles. Maybe we help the testosterone to, be more in our bodies. There's lack of exercise. There's more fat-inducing diet, and there is lack of, maybe we don't use as much of lycopenes which are present in tomatoes and so on. So less vegetable diet and more of hard. That means this red meat which is related to it. So all these are kind of projected or related causes, but definitive absolute cause we still do not know what causes prostate cancer in particular.
Along with that, we all think that factors like stress, environmental and different types of pollution, they all may act upon some small things which lead to formation of these cancers. So basically, what is a cancer? Cancer is abnormal growth of cells in a certain part of a body. Okay, here we are talking about prostate cancer. So normally all the cells in our body, most of them, like if you see on my skin, the upper layer will get off, like it will die and get off. So there is a property of cells to die automatically, and the lower cells will take off the place. So this keeps on happening, which is called a remodeling in most parts of our body. So when they lose property to die because of some induced changes in the genetic material, which is called mutation, and these mutations can be caused by all the reasons which Dr. Vivek has spoken now, and maybe as I added some stress, environmental, and different kinds of pollution which we see today. So these then start or kickstart the cancer or the abnormality in the tissue, and that will spiral finally into prostate cancer.